Our center is one of the few comprehensive fetal care centers in the world, and we specialize in the full spectrum of fetal condition.
This is a journey that starts in pregnancy and before baby is born, but it's going to continue sometimes long after baby is born and even into childhood. And really our goal here is to make this a medical home for patients.
The Cincinnati Children's Fetal Care Center is led by physicians from Cincinnati Children's, Tri-Health, and University of Cincinnati Medical Center. Having extensive medical resources in a single setting allows our team to offer comprehensive care for mothers and babies facing the most complex fetal conditions or high-risk pregnancy and delivery. Since 2004, the Fetal Care Center has evaluated more than 6,900 patients and performed more than 1,800 fetal procedures.
Well, it's been quite a journey. Can you look? Look at the microphone. When we had our meeting up here, that was when we found out a lot of things about Landon.
The Fetal Care Center understands that an unexpected fetal diagnosis can be overwhelming. We help families navigate even the most complex conditions.
At the first appointment, we perform advanced imaging and genetic testing as necessary to get an accurate diagnosis, and we then formulate a plan amongst the team members to come up with what we think is the best plan to get the best outcomes for the babies and the moms, and then we present that in a team fashion to the patient and their families.
We are one of the few fetal surgery centers in the nation with the expertise to perform the complete spectrum of fetal interventions. We are the highest volume fetoscopic center in the United States. Fetoscopic procedures are less invasive than traditional surgery, with fewer risks for both mom and baby. In addition to performing fetal interventions, we also offer delivery at the Cincinnati Children's Fetal Care Center Special Delivery Unit.
They weren't really sure what the outcome was going to look like, but they did suggest during that meeting that he would be born here.
If your baby needs advanced medical care or surgery right after birth, you may be able to deliver here. We've delivered more than 300 babies with complex congenital conditions at our 6-bed Special Delivery Unit. Our top-ranked Level 4 newborn intensive care unit is right down the hall.
Mom is not anymore left behind in another hospital and separated from their baby. And the families are all together in one setting where we take care of the mom and their babies after delivery.
It was great knowing that he was down the hall and Jen was with him.
Our researchers and physicians pioneer new and innovative therapies to provide better outcomes for babies. We also lead research to improve care for newborns.
I am very proud to lead this lab, the Center for Fetal and Placental Research, just because we can analyze all the natural history of congenital malformations and look for innovative ways to treat in utero all these conditions, with the idea not only to fix, also to improve the outcomes of these patients.
One of the really cool innovations that we're very excited about here is a system called Carpe Diem. This is the first FDA-approved infant-directed form of dialysis. We're the first hospital in the country to be using this system.
By working as a team across all subspecialties, we're able to improve the outcome for even the most fragile babies before, during, and after delivery.
Landon is thriving. He has had 5 surgeries, all done here.
We will be with these families every step of the way as they are navigating down the difficult journey.
Landon would not be as successful as he is. He may not even be here today if it weren't for Children's.
Are you flirting with everybody?